Hey, everybody. Welcome to another episode of Confessions of a Male Gynecologist. I am your resident OBGYN and tour guide, Dr. Sean Anthony Tasso, an America's Holistic Gynecologist. Now, this weekend, I had, for the first time ever, one of my TikToks go viral. For me, viral is about 170,000 views. And it was 5 things I wouldn't do if I was a woman. One of those 5 things was I wouldn't use hormone pellets. And I say this as a pellet anarchist and as a pellet survivor. I actually did try pellets years ago as a man and had probably the worst experience of my life. And I also have a big divot in my butt, which is TMI, to prove it. So don't just assume that because I'm a man, there's a lot of the criticisms where, oh, you're a man, you don't understand. Well, I'm also a pellet survivor. But let me reiterate. First of all, what I got from this post was that a lot of women are using pellets, number one. Number two, a lot of women don't even know what hormone pellets are. And so I wanted to do a podcast episode on the pitfalls of hormone pellets. I wrote a blog about this about 2-3 years ago, probably 3 years ago now. And I will tell you this, I would be rich if I put in hormone pellets. I have so many hormone patients that if I actually did hormone pellets in my practice, I would be rich. So I'm not doing hormone pellets, not out of anything other than the fact that I've seriously looked at the science, I've seriously looked at the complications, and I can't bring myself emotionally, spiritually, psychologically, or physically to put them in. Hormone pellets are these little tiny, maybe like the size of 2 pieces of rice put together, pellets that are inserted into your backside, usually by a practitioner that contain estrogen, progesterone, testosterone. I think they can put DHEA and some other medications like anastrozole and things like that. And they've been around for decades, but they've really made it to the forefront by a couple of companies who I'm not going to name. But these companies really target, they used to target OBGYNs, but the OBGYNs really as a group haven't really fallen in line with pellets. And so they've gone to family practice, nurse practitioners, now plastic surgeons. So pretty much anybody's putting them in. And so I came up with 10 reasons why I'm not somebody that really supports the use of pellets. So knowing that what they are, these little subdermal implants, usually you're going in every 3 to 6 months to have these dug into your skin. And I have been seeing a lot of complications with them and a lot of unhappy patients. So here are my 10 reasons. Now, this isn't to say anything about the medicine that's in the pellet, because I am a fan of bioidentical hormones. I am a fan of topical bioidentical hormones. I'm a fan of sublingual bioidentical hormones. I'm also a fan in certain instances of oral bioidentical hormones, especially with progesterone. I'm not a fan of the subdermal implants for the following 10 reasons. Number one, they're expensive. Actually, they're way too expensive. Pellets are somewhere between $300 and $400 every 3 months. Basically comes out to about $100 to $125 a month. Bioidentical creams or the sublingual troches or rapid dissolve tablets at reasonable compounding pharmacies are about $45 a month. And if you buy 3 months at a time of the topical creams, it comes out to about $39 a month. Pellets delivering the same medication cost about 3 times the amount of a compounded cream. So you're paying more for the same product. It's just a different delivery form. So that in and of itself to me is somewhat of a problem. I don't like it when you have to pay more for the same thing. And the reason that you're paying more, there's two reasons. One is the offices that have to buy these products, usually they're joining through a company, of which there's 2 or 3 big ones here in this country. When they buy into the product, they have to pay a monthly fee, and the monthly fee has to be offset somehow. So they're passing that along to the patients. And it's also technically a procedure. So you're paying for the procedure time and the prep and all the things that the offices have to pay for. Number two, and this may be the most important reason for me, the hormone levels that one achieves through subdermal pellets, hormone pellets, are too high. And I believe in many instances, dangerously too high. Pellets will be explained to patients in the offices or sold even as maintaining a level hormone balance. The medication is released at a slow rate over time. So you're going to get this kind of steady state and everything's going to be kumbaya and you're going to feel amazing. But if you really think about it, there's absolutely no way this can be true. There's no way that this pellet under your skin could deliver the same amount of medication every day for 3 months. And inevitably, what happens, and we've seen this numerous times, is the first month your body releases a large amount of it. It goes super high. And then over the next 2 to 4 months, it slowly tapers down. If you plot that out over years, it looks like a saw. Up, down, up, down, up, down. So you're really never getting what they're claiming to be this steady state of hormones. There's no guarantee that the same amount of hormone will be released on a daily basis for 3 months. There's no way they could possibly guarantee that. And what I normally see is that sawtooth pattern. So what happens is you get the pellets put in, and I see this all the time. I have women that basically will call me a liar on social media sometimes because they'll say, I get my pellets put in, I feel great. And that's true. Who wouldn't feel great with your hormones being 4 times normal rate? You feel like Superwoman. But then for 2 months, you have a steep fall. And what happens is you feel great for that initial 1 month to 6 weeks. And then as the levels start to drop, even though you might be 3 times normal still, you're not as high as you used to be. So what happens is you start feeling like crap and you're like, oh my gosh, I got to go get my pellets again. But you still have super high levels. It's a withdrawal effect. And I kind of look at it like the famous sports drink that's out there that all the kids are into, where it's marketed as this thirst quencher, if you will, but they put citric acid in it. And what does citric acid do? It makes your tongue feel dry. And so you drink more. Pellets, in my opinion, are kind of this negative feedback loop where you feel good for a few weeks. And then as the levels start to decrease, you feel it. Now, like I said, your levels are still super high, but you feel like you're having those symptoms again because you're not as high as you used to be. So you go back in for pellets because you have this withdrawal effect. It's almost like a self-fulfilling prophecy, and it's almost a way to keep you coming back. The problem is that when you feel these withdrawal symptoms, it's not because your levels are actually low, because they're still actually high. They just aren't as high as they used to be. And so women will come in and say they need they think they need more estrogen or testosterone because they don't feel like they did when they got their pellets a couple months ago. I'll draw their levels and they're still 3 times the normal rate for a woman. So that's another reason I don't like pellets. Number 3, technically it's a surgical procedure. If they tell you that it's not, that's not true because it is. They have to prep the area with iodine. They put a little surgical drape on you. They have to numb the area up. This is a minor surgical procedure. They have to be put under your skin every 3 months. The provider has to dig a pocket in your fat of your, basically your back end or your butt cheek to get the pellet to stay in. The results sometimes from the pellet insertions, and you can talk to people if they're being honest, bruising, infections, the pellets shooting back out the poke hole site, and pain. Those are the minor complications. Some women have things that are even worse where they'll have major infections and they have to have an excision or something along those lines. It's one of those things where this is coming at you every 3 to 4 months. And so it's not like it's just a one-time deal and then you don't have to think about it ever again. You're having to repeat this episode every 3 to 4 months. Now, women that I've met that even ended up liking the pills for whatever reason, the pellets, will eventually become fatigued with this anyways, because who wants to go in every 3 to 4 months and have something put in your butt? Well, I should say your butt cheek. Sorry about that. Number 4, once these pellets are put in, they don't usually come out. They're not made to come out. Sometimes your body will reject them and they'll get spit out. But for the most part, they're not supposed to come back out. And they're stuck in there for 3 to 6 months. Now, I have multiple patients that have come to see me from providers, some GYNs, who put the pellets in. A normal total testosterone level for a female, the upper end of normal is around 64. I've had women come in that are in the 300s, many in the 200s. They feel miserable. They feel like they want to choke someone. They're very agitated. They're anxious. And I can't help them to get the pellets out. And it's funny because when they go to their doctors who put the pellets in, they're like, oh, well, we'll just put you on this anastrozole, or we'll just put you on propranolol to calm you down. So now they're adding another prescription medication to offset the side effects of the medication they put in. I've also seen them automatically put those medications like anastrozole into the pellet to offset the side effects of the medication that they gave you. To me, that just seems utterly ridiculous. I actually had a doctor reach out and criticize me and say, well, I don't get high testosterone levels because I automatically put anastrozole in. And I'm like, well, if you know that you have to put anastrozole in because your levels are going too high, why are you putting them in the first place? And I got crickets. So as a recap, the first 4, they're expensive. Your hormone levels go too high. It's a surgical procedure. And once they're in, they don't come out. We talked about this one briefly. Number 5 is you have to have it done every 3 months. Now, you're told this. Usually you'll have to go in, and sometimes it may be 4 to 6 months, depending on how you process the hormones. Simply put, why would you do anything that required you to go to the office every 3 months to have a small surgery? It makes absolutely no sense to me whatsoever. The cost alone should have been a derailment, but the idea of digging a pocket into your backside with a needle, a trocar, every 3 months, if we think logically, is enough for most women to say no. Now, why do women do it? Well, I think they feel better. And I'm not going to deny that. I'm not going to deny that there aren't a lot of women out there who feel better when they have pellets put in. I don't have a problem with that. The problem that I have is with the extended exposure of your body to testosterone, estrogen levels, whatever it is, that are sometimes 3 to 5 times normal levels. Over time, what is that going to do to you, and what is it going to do to your body? Well, if it's testosterone, you could have abnormal cholesterol values, you could have anxiety, aggression, insomnia, acne, hair growth, things like that. And there's 2 irreversible aspects of pellet testosterone therapy if the levels go too high, and that is clitoromegaly, where the clitoris gets enlarged and starts to look like a small penis, and voice deepening. Voice deepening is a permanent transition. So if and when these things happen, those are irreversible. And, they're not life or death, but I don't know if a lot of women would want to trade the gamble or take the gamble on having a deeper voice just to feel better when there are other options available, like topical creams, sublingual troches, rapid dissolve tablets, even vaginal creams and things like that. Now, I'm going to put this proviso in there. I don't put pellets and injections in the same category. Injections are kind of a new approach. There are some doctors out there doing hormone injections. I don't agree with them. I don't think that that's a good way to do hormones for women either. Probably not the best for men, but it does cause a unstable environment. And again, with injections, the levels are just usually too high. The better part of an injection is that it's only in your system maybe for 3 to 7 days versus 3 to 4 months, like a pellet is. And so even if you don't like the effects of an injection, which usually is every or 2 times a week or at the most 1 time a week. I had one patient came in, said that she was on testosterone injections once a month, which wouldn't even do anything because it would wear off in probably 3 to 5 days. So what are they doing the other 3 weeks out of the month? What you're going to find in this hormone realm, and we're going to get into this in a little bit, is it's kind of the wild, wild west. And unfortunately, women are paying the price, literally and figuratively here, because there's a lot of wannabes. There's a lot of practitioners out there that aren't really experts in the field of hormones, and they're dabbling, and because it sounds fun, it's a procedure, they can make money. And what you'll usually find is if it's not a doctor putting them in, there's a doctor that's supervising, which means they're probably not even in the facility. They're just, sitting there with their MD on the book so that they can order the pellets and so that they can have a nurse practitioner or a physician assistant or somebody like that put them in. Number 6, absorption rates are irregular. I kind of hit on this a little bit before. The pellets are sold or promoted as being the ultimate in stability and stable absorption rates. But as I've explained earlier, it's just simply not true. There's absolutely no way to guarantee that. And actually, there are many, many studies out there that actually show this isn't true at all, that the release is very sporadic and erratic. And what we tend to see as a trend is that for the first 1 to 2 months, the levels go super high. Like I said, super physiologic, probably 3 to 5 times the normal, a high end of normal for a woman. And then slowly over time, will taper down back into the normal range. And I've seen anywhere from probably 3 to 6 months. Most of the time, I see that most of the time the hormones are back to normal or low normal within 6 months. But that's a long time to wait, especially if you're not feeling well from having such a high rate of hormones in your body. And so that harkens back to this aspect of, well, if I don't like them, what do I do? And usually the response is, well, you just got to ride it out because we can't dig this little grain of rice out of your butt cheek. Now, it's different in men because men will tend to get 8 to 10 pellets at one time. Women usually will get 1 or 2. And it's really hard to dig out 1 little grain of rice or 2 grains of rice. So for women, the aspect of trying to physically remove a pellet is pretty non-existent. I've tried it once or twice and was unsuccessful in both. And so I don't even try anymore. What I usually will do if somebody comes in and they're having a lot of symptoms from the pellet is that to just try and give them symptom relief however I can so that they can at least ride it out. Number 7, show me the money. And I'm going to be honest here. Like I said earlier, if I use pellets in my practice, I'd probably make an extra $25,000, $30,000 a month. And that's a conservative estimate. And the reason I know this is because I have a lot of friends that do it and they don't have a big a hormone practice as I do. And that's kind of what they're making. And I'm going to set this out there. I'm not against physicians making money. I mean, we have jobs, we make money. We all make money at our jobs. And doctors, unfortunately, make more money on procedures. So yes, could there be a procedural bias in medicine, or you're going to do things that obviously make you more money? I operate, I do surgeries, I do robotic surgeries. I make money. I'm not shaming any provider for making money. It's what we do. What I think is a problem is the vast number of women in my practice that could benefit from hormones. I feel like I would be doing them a disservice if I put in a pellet. I'd make a ton of money, but I wouldn't be able to sleep at night. This procedure is a cash cow. It's a cash cow for any office that puts it in. every 3 months, hundreds of women have to come in to have their hormone pellets replaced or placed, and they're all paying, like I talked about earlier, $300 or $400. And, you're spending $1,200 a year, usually, maybe more. Some of these are now, some of these companies are actually also coming out with supplements. So now the doctor's offices are adding in supplement lines. So it's obvious that it's a money-making endeavor for most offices when they start doing. And you can really see this now because there's so many doctors' offices, including now doctors that used to have absolutely nothing to do with hormones, dermatologists, plastic surgeons, and now all of a sudden they're putting them in. And the reason for that is the companies that make these pellets saw that there was an opportunity, and it's America, land of the free, home of the brave, and capitalism all the way. But they saw an opportunity with plastic surgeons because mostly patients at plastic surgery offices are women, and they're wanting to look better, they're wanting to feel better, which is why they're in a plastic surgery office in the first place. And so my problem with this aspect is that you have number 8 is who's putting them in. If I haven't made any friends up to this point in the medical field with people that are putting in hormones, they're certainly not going to like me now. Simply put, the people that put them in, as a generalization, this is not true for everybody, obviously, but a majority of the providers putting them in have no idea what they're doing. They went to a weekend course that these companies put on. They're usually not using their brains to come up with the dosing. They're usually using some sort of protocol that the company came up with. I would call them hormone dabblers. They're usually physician extenders or doctors like emergency room physicians that have never dealt with hormones. And like I said, these courses are very small. They're 2 or 3 days, and they talk about the marketing also. So it's not even 2 days of actual talk about the hormones. It's about marketing. It's about putting them in. It's about buying the product. It's about a lot of things. So let's say they even get 1 full day of hormone replacement and hormones. They really can't be coming out of that class in a weekend as an expert. It's just not going to happen. And then they're going back and they're putting pellets in. And usually they're working under the auspices of a doctor, say a plastic surgeon or somebody who wants to add these to the office because it makes money. Like I said, obviously they wouldn't be doing it if it didn't. And they have this physician extender. Now, I'm not saying that the extender, the NP or the PA that might be putting these in sometimes doesn't have a basis of knowledge in hormones. They may very well. They may have worked in women's health. They may have worked in men's health, and they have that knowledge base. But there is no expertise in hormone pellets. I'm telling you this right now. What it is an algorithm. It's a protocol. They somehow have chosen to have, and I will tell you, the upper limit of normal for a total testosterone in women is about 64. And it'll vary depending on the lab that you're using. But let's say the lab I use is 64. Most of the pellet companies have randomly chosen somewhere between 100 and 150 as normal for some reason. They're rewriting the normal. And I blame some of this on the whole functional medicine thing, because the concept of functional medicine is that there's this optimal range. And that's debatable, but they have somehow picked 2 times the upper limits of normal for a woman with a total testosterone as being normal. And so what they do is they automatically overdose because they think they're trying to achieve this level that they don't even understand how they came up with the level. I have challenged multiple providers, and I would put this challenge out there again. Show me some research that shows that a testosterone of 100 is safe, effective, or otherwise okay for a woman, and I'll look at it. Show me something that says that pellets are stable released. Show me something that says they're safe. Show me something that says they're not harming patients. and I'll read it. But I can tell you there are numerous studies out there that say the exact opposite. They're in support of what I say, and that's why I'm saying it. I have asked this question numerous times. I've never been presented with one iota of data. Now, I would assume the companies themselves have data. The question I have is, if you're really the company that's making millions and millions and hundreds of millions of dollars, this is the problem with research, and you're doing the study, how do we know it's really an unbiased study? It's not. It's a biased study because you have a monetary vested interest as the company that's putting these out. We see this all the time in pharmaceuticals. But show me an unbiased, prospective, randomized trial that shows that patients are doing well and better, and it's better for them to have levels 2 to 3 times normal, sometimes 5 times normal in a female population. So you see the companies that sell the pellets, they have the courses, people go to them. It's just that expertise, in my opinion, comes from years of study coupled with years of patient encounters. And I can't tell you how many times these offices will say that they're expert, they have an expert, a hormone expert. I know it's harsh for me to say that. I'm not one to suggest things. There is a reality that pellets, do help some people. I mean, that's just the nature of the beast. But I personally feel like anybody that's worth their weight as a provider that looks at pellets with an unbiased, non-monetary mind can find me a reason to put them in. I've wanted to put them in because, like I said, I could make a lot of money. I haven't found one thing that has given me that information that I'm looking for. And I've had I have 2 or 3 really good friends or acquaintances sometimes that put them in, and they're OBGYNs. And they've told me, oh man, you need to put pellets in. They're so great. And I always say them. I say the same thing. I've said it to them many, many times. Show me some research that says that they're safe, effective, they have normal blood levels, and I never get a response. And so I'm just putting it out there. I hope somebody responds and can show them to me. Number 9, it's a club. The offices that are putting them in have to pay to play. These big companies, and again, I'm not going to name them, but I can think of 3 off the top of my head, and there's always more popping up. They usually are charging a membership to the office. So the office has to pay a monthly fee to use the company name, the company logo, the company's product, and they have to buy the pellets from the company. So not only is the company charging an arm and a leg for this membership fee, they're charging for the pellets. So they're making money 2 ways off of the provider. That's part of the reason why the pellets cost so much, because they're passing that cost on to you. So because these doctors are invested, they've paid this money. They've paid sometimes $1,000 for product advertising and all that stuff. Because they're invested, they're obviously blinded to this fact, and they are more inclined to use the pellets because they're spending money on it. And lastly, number 10, I feel like, and this is my opinion, and as always, these are my opinions. They're not medical advice. They're my opinions. I have many, many women that ask me questions online. I can't answer them because I don't know your situation. What should I do? I'm supposed to get my pellets tomorrow. I mean, I can't answer that because I'm not your doctor. But number 10 is, I feel like you're a number. If and when these practitioners draw your blood, usually they'll draw blood at the beginning, but they sometimes don't draw blood again. I've had so many women that don't have blood levels even after 6 months worth of pellets. Some do, and that's great. I'm glad they do. But then the question is, are you actually seeing your lab results? Are you looking at the numbers? Are you looking to see if you are super physiologic? And are you asking questions like, oh, why am I 3 times the normal rate? Is that safe? What these providers do, and again, generalizations, I'm not saying it's all providers, is that they draw your blood, They'll take the results, they'll feed it into a program, and the company tells them what dosage to use. The experts like myself, we don't have a protocol. There's no hormones are not, they're individualized. And that's what's a little bit contradictory in my opinion with these companies is if you look at the morning TV shows they've been on and some of the other things they've done, they'll talk about how these are bioidentical, they're made from plants. Well, all bioidentical hormones are made from plants, so that doesn't matter. They try to say it's natural. There's absolutely nothing natural about shoving a pellet under your skin. I mean, you're not an animal, you're a human, and there's nothing normal about putting a hormone pellet under your skin. Heck, we don't even like to eat meat anymore that has hormone pellets influence. So why on earth are we putting them in human beings? It doesn't even make sense, but they use the right phraseology: natural, made from plants, things like that. So basically, I don't like protocol driven hormones. I think that hormones are very scientific. I think there's a lot of data on hormones. There's good, there's bad, there's ugly. However, if we want to stay on the good, we look at your individual lab results, we look at your individual symptoms. There is no machine that I'm going to put your data into. That machine is, for me anyways, is the 40 to 50,000 women that I've seen over the last 20 years. That's my abacus or my database. So it's experiential. I know that all 10 of these are a lot to consume. And the sad thing is there's even more reasons that I could talk about, but I'm going to stop here because I want you to be able to digest this. And I'm sure I'm going to get some kickback on this because there always is. I've had the hormone companies actually attack me on Instagram. One particular company had its employees come after me on Instagram, and they're dumb because they don't realize that I can see they all work for the same place. And so it's a little unnerving to put yourself out there and to be under the microscope. But I really feel in my heart that these are not good for you, that they are bad for you, actually. And if you have pellets in, let them dissolve and switch over to a topical cream or a sublingual troche. Take back your hormone balance. Don't be sold a Trojan horse. These are Trojan horses to sell you other things as well. If you look at, there's now some of these companies have their own supplement lines now, and that's because they know that there's money in supplements. And so you'll get your pellets, and now all of a sudden you're buying 3 products that you didn't necessarily need. They make you feel better initially, but at what cost? With levels so high, they can have the side effects and withdrawal symptoms like I talked about, and then you want to use them again. So to reiterate, the 10 reasons that I don't like hormone pellets: they're expensive, your hormone levels go way too high, it's a surgical procedure you're having every 3 months. Once they're in, they don't come out. As said before, you have to put them in every 3 months. Absorption rates are irregular, high then low, sawtooth pattern. The people putting them in are biased because they make money putting them in. They make a lot of money putting them in. Who's putting them in? Most of the time, the people putting them in aren't doctors, which is fine. There's no reason it has to be a doctor. But I don't think that it necessarily lends itself to having expertise in that field. It's a club. Doctors have to pay to play, so they pass that along to you. And I also believe that you're a number. I want to tell you a little story. This weekend, this is my confession. I was openly attacked on my Instagram page this week by another provider here in Austin who is a nurse practitioner. She came onto my page because I put that post up about how I didn't like pellets and basically told me that she knew more than I did about men's health, which is true. I would never say I'm an expert in men's health, which would also then confer that I probably know more than her in women's health, just by sheer will and time and age and the fact that I trained to do this. I found out after she attacked me. And I was really surprised by it because I'd never really had an incident like that yet. I've never been openly attacked. And after I was attacked on my feed, this individual then went to my direct messages and just said a bunch of really mean stuff and then blocked me. I couldn't respond, not that I would want to. And then unblocked me, wrote a bunch of other mean stuff, and then blocked me again. And so obviously I triggered this person, and I'm sorry about that. I don't say things to trigger people. Well, sometimes I think I do. And I'm sorry that this upset people. This is my opinion. And the great thing about this country is we are all entitled to our opinion. I have an imprint, and I'm going to say what I think is best for my patients. I'll even have patients not agree with me, and that's fine too. I'm not here to. The beauty of medicine is that it's an art, and we all practice a little bit differently, and we all have our own opinions. My opinion on pellets is that they're not good, and I'm sorry if this individual that was upset with me because she puts them in at a plastic surgery office. I don't agree with it. And I don't have to agree with it. She doesn't have to agree with me. But I think to openly attack somebody on their own Instagram page is wrong. I think it's unprofessional, and that's my confession. I apologize to the individual that I upset. It was not my intention, but I'm speaking my truth, and I'm going to keep doing it. Lastly, with hormones, with bioidentical hormones, and I think I need to talk about this in a separate podcast. Bioidentical hormones versus synthetic hormones. Used to be 10 years ago, 15, 20 years ago, we had Premarin and Prempro. And then the Women's Health Initiative came out about 15 years ago and really set the world on fire. Women stopped going on their hormones and everybody was miserable and blah, blah, blah. To this day, we're still afraid of hormone replacement because of that study. And there were many, many flaws with the study. Synthetic hormones are simply the hormones that were made from like horse urine. Most of the progestins on the market are synthetic. They're made in a lab. Now, bioidentical hormones are also made in a lab. They're just made from plants. So they're made from wild yam usually, or some other soy, something along those lines. Estradiol, testosterone, progesterone, they're all made from the same thing. Now, one of the selling points with pellets is that they will say they're plant-based. Well, like I just said, all the bioidentical hormones are plant-based. Topical creams, sublingual troches, they're all plant-based. So that's not really a selling point because you can get the same products in what I think is better dosing, more safer dosing, and they're all plant-based. And they will also sell this aspect of bioidentical. Now, bioidentical is getting attacked by some of my colleagues that are very, very allopathic, in my opinion, very misogynistic, because they're trying to get bioidentical hormones removed from the market. And not because they're against the hormones. The hormones themselves, estradiol, progesterone, testosterone, DHEA, the bioidentical hormones are all FDA approved. The hormones themselves are FDA approved. What's not FDA approved is the delivery system, the pellet, the cream, the sublingual tablet, and the pharmacies where they are made. The compounding pharmacies are not FDA approved because the FDA doesn't go around approving pharmacies. But the hormones themselves are FDA approved. And to prove that, there are hormones on the market that you can prescribe at Walgreens or CVS or any of these other chains where the hormones, Prometrium used to be Prometrium, now it's just progesterone, micronized progesterone, bioidentical. Estrace is a company that's been around forever. Vivel Dot. These are all pharmaceutical grade, big pharmacy forms of hormone replacement that are indeed bioidentical. So there are bioidentical options everywhere. These people that badmouth bioidentical hormones and then turn around and prescribe someone micronized progesterone, they're contradicting themselves. They're hypocrites. What they don't like is the compounding pharmacy. I don't know why. I think I've had a lot of women that have been able to have great relief. There is a petition going around right now. I'll probably put it in the show notes that you can sign as a patient because these people have a very large voice. They're petitioning Congress to clamp down on bioidentical hormone production by these compounding pharmacies. I think it's very misogynistic. I think it takes away the rights of women to make a choice for themselves as to what form of birth control they want to use, and it forces you then to have to use big pharmacy. This is obviously politically and monetarily driven, and I think it's wrong. So I'll put that in the show notes if you want to take the link and sign the petition, so that Congress can see that there's millions and millions of you out there that actually don't want your rights taken away and you would like to continue using your compounded hormones. This is Sean Tassone. Thanks for listening, and we'll talk later.